I am Dr. Sujatha Nalaparedi, medical oncologist, practicing at Rocky Mountain Cancer Centers, Denver, Colorado, United States. And I'm a friend of Shubhasri, and it's my privilege to talk about breast cancer awareness during the month of October, which is dedicated for breast cancer. So coming to the breast cancer awareness and the facts, breast cancer is still the most common cause of cancers in women worldwide. It's estimated more than 1.7 million cases of breast cancer occur worldwide every year. And breast cancer rates incidence vary worldwide. It's more common in Western world where it could be due to more the risk factors being dietary factors or lifestyle changes or reproductive factors, which could be the causes. So if you look at the risk factors for breast cancer, just being a female itself is the risk for having breast cancer. And women above 40 years and especially above 50 years are at higher risk for breast cancer. And the risk factor, the other contributing factors for increased risk would be early age of menarche and late age of menopause and use of estrogen therapies like birth control and also hormone replacement therapy after menopause have been associated with increased risk for breast cancer. Hormone replacement therapy used to be the most common practice in early 1990s and early 2000, where it was used for all women who attained menopause to help with their menopausal symptoms, but then it's been associated with increased risk and the practice has been stopped lately. Unless women really need a hormone replacement, then we use it. So if you look at the lifestyle risk factors which are associated with breast cancer, being obese, where your BMI is more than 30, smoking, alcohol, and have been also associated with increased risk for breast cancer. Also, women who have kids later in their life or have not breastfed are also at increased risk for breast cancer. So also there have been some studies looking at dietary factors like vitamins and aspirin if they are associated with decreasing the risk. There have been some studies looking at vitamin D levels associated with breast cancer. Some initial studies did show that low vitamin D levels have been associated with increased risk, but meta-analysis and bigger studies have shown no associated risk. But I think it's reasonable for women to maintain their vitamin D levels. So if women come to me and have their vitamin D levels low, I tend to put them on vitamin D supplements to make sure their levels are good because it also helps prevent osteoporosis. And regarding the aspirin, we all know that aspirin has been proven to help with decreasing the risk of cardiovascular risk, and so I don't think it's harmful to take a baby aspirin one a day if you want. So then coming to the screening for breast cancer, we are fortunate that only there are 2 to 3 cancers which have screening associated with them, like breast, colon, and prostate cancer in men. And breast cancer is the only cancer where we have screening start even at age 40 for females, which helps detect breast cancers in very early stages. So screening is a test where you're detecting cancer even before you have the symptoms or have masses palpable in the breast. And so that's the benefit where you're diagnosing early stage of the breast cancer to help treat effectively and even cure the patients. So coming to the screening for breast cancer, what are the modalities we have for the screening and when do we start the screening? So the screening modalities we have for breast cancer are mammograms, as you all know. And in mammograms, we have screening mammogram and diagnostic mammogram, and MRI is the other modality, and ultrasound of the breast is the other modality we use. So then, if you ask me, how effective is breast exams? There have been a lot of studies shown that mammograms are more effective than self-breast exams. I would recommend females know how their breast do feel and look like, so that if they develop any masses or anything, they can easily palpate. And the best way to do a self-breast exam is to fix a day once a month and do it on the same day, so that it's not affected with your menstrual cycles. Coming to the mammograms, what's the age to start the mammograms? Nowadays, the guidelines are to screen mammograms at age 40. Some age 40 to age 45, women can elect to do mammograms every year, but women between age 45 to 55 have to do mammograms yearly, because that's the most common age group where we see increased incidence of breast cancer. And after 55, it's up to the females, and we do recommend they continue with mammograms yearly as long as they want, or if 10 years above their life up to 10 years of their life expectancy is recommended. So we do see females doing mammograms up to 75 to 80 years of age too at this time. So what's a screening mammogram? So screening mammogram is where, as I said, it's a 2D image of the breast, which is done, and it takes up to 10 minutes, and it's done in a radiology place, a mammogram place, where they too tend to take pictures of your breast, and then the radiologist reads the mammogram. If there is any suspicion, like you can see like calcification, like white spots in the mammogram, or if they see any masses or for suspicion, then you might be asked to come for diagnostic mammogram, where they take more pictures of the breast. And nowadays there is good modality with mammograms, which is called tomosynthesis, or also 3D mammogram, where the machine rotates around the breast and take good pictures, and the radiologists get a 3D picture of the breast, and it's being more sensitive to diagnose very small masses. And if you do have anything abnormal in the mammogram, then you're asked to come for ultrasound biopsy or MRI, which is more specific test and sensitive test to detect. We do not recommend MRIs for all. Only patients who are high risk are recommended to get MRIs in addition to mammograms. Who are the high-risk patients? Patients who have family history of breast cancers, and also who have genetic abnormalities like BRCA1 and BRCA2 mutations, and then also patients who have had radiation in their early part of life for some other conditions are at high risk, and we recommend mammogram along with MRI for these patients. And last but not least, I also want to talk about genetic factors associated with breast cancer. So if you do have a family history of breast cancer, then you're 10 to 15 times at increased risk for breast cancer. And also there are certain mutations which are inherited and genetic, which could be associated with increased risk for breast cancer. And the most common mutation is BRCA1 or BRCA2. The other way to call is BRCA1 and BRCA2 mutations, which are more common in Ashkenazi Jewish descent, but we are tending to see it in other populations too. And just to give you an example, Angelina Jolie, the famous Hollywood actress, had BRCA1 mutation, and she did have prophylactic mastectomy done as part of prevention for this breast cancer. And also, if you have very high risk, there are also some preventive measures you could take, like some anti-estrogen therapies to help decrease the risk for breast cancer. And also, it's an exciting field where we have a lot of treatment options for breast cancer too at this age. If you get diagnosed with breast cancer, it's going to be a multimodality therapy where you have a medical oncologist, surgical oncologist, and radiation oncologist who are involved in your care. And if you have early stage of breast cancers like stage 1, stage 2, or stage 3, it's a curable situation. if you have the cancer spread outside the breast, it's a stage 4 breast cancer where it's not a curative condition, but it's still treatable. And with all our treatment options which we have at this age, with chemotherapy, immunotherapy, targeted therapy, we are being able to extend life expectancy even for stage 4 breast cancer patients who are living years at this time. So I think that's my conclusion today, and I hope I did give some awareness of breast cancer today, and I'm hoping all the women who are watching this will start the mammograms if they are above 40 years of age. Thank you for your attention.